Hello there, I am Dr. Prasanth Pillai. I am a dental specialist and an oral and maxillofacial surgeon based in Kochi, India. Today, in this video, I would like to show you how we do a full mouth reconstruction with dental implants. So, a full mouth reconstruction means we are going to reconstruct the entire mouth which has been damaged because of various reasons. It can be because of decay, it can be because of loss of teeth, it can be because of malpositioned teeth, or it can be even because of malposition of the jaws. So in such a situation, a full mouth reconstruction will definitely provide the patient with a renewed set of teeth and jaws, thereby contributing considerably to his good health and well-being. So that's me. I am a maxillofacial surgeon, and I am also an implantologist. I am a mentor of the International Implant Foundation Germany, and I am also a fellow of a couple of societies, implant societies. And full mouth reconstruction with advanced dental implants helps transform dental health of patients and enhances their quality of life by recreating a beautiful and functional mouth. Now, let me just narrate the story of a 54-year-old lady patient who came to me with the following complaints. She had several missing teeth, painful and mobile existing teeth, bleeding and painful gums, pus discharge from the gums, bad breath, extreme difficulty in chewing food, wobbly and painful dentures, multiple ulcerations due to denture, and all these were really disturbing her in a big way, such that her life was really compromised. She could not chew food properly, she could not smile properly, she had multiple issues, and that was the situation in which she came. You can see she was wearing a denture. These were the upper and lower dentures she was wearing, and this is the gums. You can see the gum after the denture has been removed, and as you can see, the teeth, the dentures were taking support from the natural teeth which were there, but even the natural teeth were giving way because of gum disease. So that is her x-ray, the pre-operative x-ray with which she presented. You can see there is a lot of bone loss all around, and the patient gives a family history of aggressive periodontal disease. She was a very sincere dental patient who had undergone almost all kinds of dental treatment, including fillings, root canals, periodontal surgeries, bone grafting procedures, laser procedures, crown and bridge work, so on and so forth. And all the conservative procedures failed, and finally the patient ended up with a removable partial dentures. But when the removable dentures turned mobile, as the remaining supporting teeth gave way, she had no other treatment option left. So the options she had: number one, to lead a compromised existence, to continue undergoing extractions and replacement of the ill-fitting partial dentures till she enters the complete denture phase. Number two was to go for total extraction and removable complete dentures. Number three was to go in for crown and bridge work, but this was ruled out in her case as her existing teeth had very poor bone support. And number four, to go for implant supported fixed teeth. Now, this picture shows the situation of removable denture situation. She could not go for this particular procedure because she had already got this removable denture procedures done, but all this was failing because she came to a stage where this will not work anymore, as the existing teeth were not strong enough to support the removable dentures. Now, the option 2 was to go for complete extractions followed by removable complete dentures, as you can see here. But this is again a compromise. Option 3, crown and bridge work, was ruled out in her case because in a bridge work you need to take support from the two adjacent teeth which are there beside, so that you are able to support the bridge. But in her case that was not possible because the existing teeth were all mobile. And the final option was implant supported fixed teeth, which was what we provided her with. So under the implant supported options, you have two ways in which you can do this. The first method is by offering an implant supported removable prosthesis, and the second option is by providing implant supported fixed prosthesis. So this is an implant supported removable prosthesis where you have, in this case, you have 4 implants, and the 4 implants are supporting the denture, and the denture just snaps on top of the implants. So this is one option. So the implant supported, now when you compare the implant supported dentures with the removable dentures, you can see there is a lot of difference. The implant supported dentures have got lots of advantages, and they are very different from the normal dentures, because there are multiple reasons for this. Everything is presented here. Why it has got a benefit over the conventional removable dentures. Under the fixed prosthesis, you have 2 options. A fully fixed implant supported prosthesis, you have 2 options. One is an all-on-4 or all-on-6, and the other is the strategic implant supported prosthesis. So what is all-on-4? All-on-4 is when you take support from 4 implants and then you fix all the teeth there. You can see 4 implants and you replace all the teeth with the help of 4 implants. All-on-6 is when you have 6 teeth, 6 implants, and then you take support of all the teeth from the 6 implants in each jaw. So here in this situation, you have an all-on-6 on the upper jaw and all-on-4 in the lower jaw. So this is an all-on-6, as you can see, in the upper jaw, and you have all-on-4 in the lower jaw. And in this image you can see all-on-4 in both the upper and lower jaws. But the procedure which we follow at our center is the strategic implant supported prosthesis, where we provide multiple implants in the upper and lower jaws to provide a full arch, cross arch prosthesis, which helps fix teeth from one corner to the other without any cantilever. You can see out here there are cantilevers. You can see the cantilever here. Now the cantilevers are not really going to be helpful in the long run, because you can always have lopsided force acting on the cantilever, thereby creating problems for the implants. But here there are no cantilevers at all, so we avoid cantilevers altogether. And these implants are placed employing keyhole procedures. There is no open surgery, and we don't do any bone grafting, which is an added advantage. So in this particular patient situation, this is what we did. After the clinical examination, we went in for the imaging, that is the orthopantomogram and the CBCT evaluation. The CBCT is the 3-dimensional evaluation of the jaws, and then we did a medical evaluation in order to secure medical clearance for the patient prior to being taken up for the procedures. And then we did the treatment planning, and then the treatment plan was discussed with the patient's spouse and relatives. The informed consent of the patient for the procedures was obtained, and then we went ahead and started the procedure. On day 1, we did the extractions under local anesthesia. You also have an option of getting this done under general anesthesia, but in this particular patient, we could do this under local anesthesia. We've done this under local anesthesia. Most of the cases we do under local anesthesia. It is absolutely, most people are scared about the anesthesia part, but we try to make this as patient friendly as possible by using topical anesthetic agents before we give the injections. And there are rare cases where patients are very apprehensive when we do these procedures under general anesthesia in the hospital. So this is the first day where we've extracted the lower teeth and we've immediately fixed the implants under local anesthesia. And the very next day we went ahead and did the upper jaw. We've extracted all the upper teeth and placed implants. And the implants are all from Dr. Ide Dental, Switzerland, and they are known as the strategic implants. And the number of implants, we use about 10 to 12 implants in each jaw. And these implants, they ensure that we are able to distribute the forces, the bite forces. So those are the implants from Ide Dental and Switzerland. And this is the laboratory technique we employ, where we use impression caps over the implants and we make an impression of the patient's jaw, and we are able to reproduce the jaw on a plaster cast. And these are the implant analogs which are there, which will represent the implants in the patient's mouth. And this is being shaped by the lab technician, and finally we provide a metal frame on top of the implants. As you can see here, this is a cross arch metal prosthesis. This is a cross arch metal frame which helps loading of the prosthesis later. And this is the cross arch frame. This frame is fitted after modifying the implant heads, and this is what we call the metal frame trial. We ensure that the metal frame fits in properly, snugly, without creating any problem. And so after this metal frame trial, we remove the metal frame, and we also do a wax bite registration to record the relationship of the upper and lower jaw with each other. And later we set the teeth in wax over the metal frame, and then we perform the wax trial. So you have the metal frame underneath, on top of which you have the wax, and on top of the wax we mounted the teeth made of composite or acrylic. And after the wax trial is done, during the wax trial we ensure that all the parameters are observed, that the bite forces are equally distributed without any problem, and the patient has to confirm the aesthetics, the beauty of the prosthesis, which is very important. The patient and his relatives, his or her relatives, they've got to determine that the aesthetics is fine. And after all this, the dewaxing is done and the final prosthesis is ready. And generally we provide a metal acrylic prosthesis in the first phase. You can see the metal acrylic prosthesis here, and this is how the prosthesis looks. You have the metal frame underneath, and then you have the metal acrylic prosthesis out here, as you can see, and this is cemented into the patient's mouth by the 4th day. So in this particular patient we could complete this within 4 days. And we provide non-steroidal anti-inflammatory drugs, antibiotics, B-complex and mouthwashes to ensure that the patient recovers from the procedures pretty fast. And this is how the patient looks after the procedure. So there are a lot of parameters which we look for. We've got to ensure that the bite forces are distributed properly in the upper and lower jaw. If the force distribution is improper, certainly the patient will develop problems and the prosthesis will end up in a failure. We also check the bite properly to ensure that the bite force distribution all around the teeth are even and optimal. Now after 1 year, 50% of patients, they develop this sort of recession. You can see a small recession of the gingiva, but this happens only in 50% of patients, and therefore we always forewarn patients that the first set of prosthesis we provide will be an interim one. It is not a permanent one. So this is an interim prosthesis. Now in this patient, what we did, we removed the prosthesis, and this was the situation which had developed. You can see the recession here, and originally the gums were here soon after we had done the implant procedures, but now the gums have receded and there's a small gap there. So what we've done, we've trimmed off the excess and we've shaped them and we've given them copings on top to help provide a proper prosthesis. And this is the final prosthesis which we provided her after 1 year. So this was cemented over the implants. So that is the way she came in, and this is how she went. That is the preoperative X-ray before the procedure. This is the immediate postoperative X-ray. You can see the bone loss here, and mind you, we've done the implants without doing any bone graft. And this is the 1 year postoperative picture. You can see how beautifully bone has grown all around. And this X-ray was taken soon after we've provided her the final prosthesis. You can see there was a very bad situation in the previous X-ray where there was a lot of bone loss. Now all the bone loss has been reversed, and now fresh bone has started growing all around, just because the implants have started stimulating the bone and the bone starts regenerating bone there. The native bone starts regenerating, and automatically the entire area gets filled up. That is the biggest advantage here. So what happens when people lose teeth? The people develop facial collapse. As you can see, the face has just shrunk. Now this can be avoided. You can see facial collapse in individuals. This is how facial collapse develops with loss of teeth. You can see how people develop collapse phases. So this has been avoided in situations like this, and this is why we call this a dental facelift, because by providing teeth to the patient who is toothless, we are able to rejuvenate her face, and we are able to reverse this condition called facial collapse. So coming to maintenance, normal toothbrushing and tongue cleaning can be carried out. A toothpaste is not really essential because you don't have natural teeth in situations where we've done full mouth implantation, but there's no harm in using a toothpaste. But please remember, flossing is not possible because there's no gap between teeth. As you can see, you need to have gap between teeth to pass a dental floss and clean between the teeth. But in this situation, it is a cross-arch prosthesis where all the teeth are connected together and you have a single metal frame underneath. So there's no gap where you can do flossing. And we always recommend use of this special apparatus called the water pick, which will help in sending a high pressure jet of water between teeth to clean the teeth in between. And we also encourage patients to use the interdental brushes with which you can clean the interdental spaces easily without any difficulty, as you can see in this picture. Now the patient also has to report back for bite adjustments once in 6 months. I always compare the implants to the axles of a car and the teeth to the tires. So the moment the car starts running, there will be wear and tear, and you have to take the car back to the service center for wheel alignment. So this is now, as I have mentioned earlier, the teeth are the tires, and you need to do the maintenance and you need to do the bite adjustments of the teeth. So this is very important to ensure that the load transmission is proper. And during the aggressive treatment phase, this is what we recommend. We recommend very soft food. Now this is idli and vada, which is the traditional Indian food. You can have soups, cold bland soups. You can have yogurt. Now definitely this will also help in reducing your weight considerably. But this is what we recommend during the aggressive treatment phase. And the facial collapse due to loss of alveolar bone height and width can be compensated with a prosthesis which will provide excellent lip support and fullness, as you can see here. So this is a typical representation of how we are able to provide excellent fullness to the lip with the help of a prosthesis. Thank you very much, and if you wish to have more information, please write to me on drppillai@gmail.com. Thank you for watching this video. I hope you liked the video. Do share this video with your friends, and if you like the video, please press the like button and also press the bell button in order to ensure that you start viewing my videos, my future videos. Thank you very much.